1. In the MoCA Executive Function Test, how can visual abstraction tasks be best adapted to adult learners with cognitive impairments in a healthcare training setting? A. Use child-level puzzles to build confidence. B. Provide guided repetition and real-life object comparisons. C. Eliminate abstraction tasks completely. D. Use only written instructions without images. 2. Which principle best supports adult learners during a visuospatial skills assessment? A. Rote memorization techniques. B. Peer competition and ranking. C. Relevance to real-life tasks. D. Passive video observation. 3. In the context of curriculum development for visuospatial skills training, which method is most effective? A. Integrating open-ended puzzles without feedback. B. Including culturally irrelevant diagrams. C. Applying task-based learning with problem-solving visuals. D. Assigning lengthy lectures without visual aids. 4. When evaluating executive function in adults using the MoCA, what is a compliant approach to ensure validity? A. Provide hints throughout the task. B. Administer in a noisy environment. C. Follow standardized instructions without coaching. D. Allow peer discussion during the test. 5. How should mentoring be structured when preparing staff to administer the MoCA visuospatial tasks? A. Focus on memorization of results. B. Use peer shadowing and reflective practice. C. Limit exposure to only one client case. D. Emphasize speed over accuracy. 6. Which strategy enhances compliance with regulatory standards in MoCA executive function testing? A. Allow interpretation flexibility among assessors. B. Train assessors to follow uniform scoring protocols. C. Modify scoring to improve client self-esteem. D. Use outdated training materials. 7. What teaching technique aligns with adult learning principles when instructing on visuospatial organization? A. Isolated skill drills. B. Integrating skills into practical case scenarios. C. Using only abstract theory. D. Offering tests before any instruction. 8. Which of the following best demonstrates an understanding of executive function via the MoCA test? A. Recalling a list of words. B. Drawing a clock with accurate time and spacing. C. Naming animals in a photo. D. Repeating a sequence of numbers. 9. How can instructors ethically address disparities in test performance during MoCA training? A. Ignore all differences to ensure uniformity. B. Discuss cultural and educational background influences. C. Adjust scores based on race or gender. D. Segregate test takers by age group. 10. What is the primary purpose of the trail-making task in MoCA? A. Assess balance and coordination. B. Evaluate motor reflexes. C. Measure planning and sequencing ability. D. Test visual recognition memory. 11. How should a mentor guide new clinicians in scoring MoCA's executive function tasks? A. Offer personal interpretations for flexibility. B. Refer only to unofficial online tutorials. C. Use standardized scoring rubrics and validation checks. D. Rely on verbal client feedback. 12. What supports accurate curriculum development and teaching MoCA Visuospatial interpretation? A. Including detailed case studies and sample diagrams. B. Prioritizing time constraints over depth. C. Using high-level statistical jargon. D. Eliminating visuals for simplicity. 13. In regulatory terms, how should data from MoCA executive function assessments be handled? A. Shared casually in team emails. B. Archived publicly for transparency. C. Protected under HIPAA or equivalent confidentiality laws. D. Used freely in promotional content. 14. Which instructional design most effectively improves visuospatial skills in adults? A. Repetitive line tracing. B. Simulations with map reading and diagram labeling. C. Memorizing optical illusions. D. Passive video watching of spatial tasks. 15. How can facilitators apply the principle of scaffolding in MoCA-related skill building? A. Start with complex tasks and reduce support over time. B. Provide minimal instructions to promote independence. C. Build progressively from simple to complex visual tasks. D. Avoid learner input during sessions. 16. When training adults in executive function tasks, which approach ensures knowledge retention? A. Gamification and delayed feedback. B. Drill and kill worksheet repetition. C. Case-based learning with immediate feedback. D. Observational learning only. 17. How can mentoring improve the fidelity of MoCA test administration? A. Assigning random test protocols. B. Using checklists and live demonstrations. C. Skipping test sections to save time. D. Allowing test takers to self-score. 18. Which evaluation method best measures growth in executive function skills over time? A. One-time assessment with no baseline. B. Comparative pre- and post-intervention MoCA scores. C. Unstructured observational interviews. D. Group consensus on skill level. 19. Which visuospatial strategy promotes neuroplasticity in adult learners? A. Randomized tasks daily. B. Regular, structured spatial challenges with progressive difficulty. C. Avoidance of challenging stimuli. D. Limited exposure to visual tasks. 20. What feedback technique aligns with adult learning principles in visual task performance? A. Vague praise for effort. B. Specific, actionable insights linked to goals. C. Generic group feedback. D. Withholding feedback to build independence. 21. What teaching technique is most effective for adults with moderate visuospatial deficits? A. Silent demonstrations only. B. Interactive instruction with physical and visual cues. C. Multiple choice quizzes without diagrams. D. Abstract theory lectures. 22. Which mentoring method helps learners internalize proper MoCA protocol? A. Hands-off observational learning. B. Structured debriefs after mock tests. C. Memorizing test scripts verbatim. D. Watching unannotated training videos. 23. What is an example of regulatory noncompliance in administering MoCA? A. Documenting results in locked systems. B. Skipping the visuospatial section based on bias. C. Using approved test materials. D. Following scoring protocols exactly. 24. Which tool enhances visuospatial training within a competency-based curriculum? A. Peer-led journaling circles. B. 3D modeling and task-based assessments. C. Written essays on spatial theory. D. Self-paced online quizzes only. 25. What cognitive domain is directly linked to executive function in the MoCA test? A. Sensory perception. B. Decision-making and planning. C. Motor strength. D. Short-term vision loss. 26. How should errors in clock drawing during MoCA be addressed in adult training? A. Correct learners immediately and explain rationale. B. Ignore errors to reduce anxiety. C. Let peers correct each other. D. Use only group critique. 27. What is the benefit of integrating MoCA-like tasks in ongoing education for healthcare staff? A. Encourage passive reflection. B. Reduce cognitive engagement. C. Promote problem-solving and attention to detail. D. Replace all verbal training. 28. When designing assessments for visuospatial skills, what ensures fairness? A. Culturally responsive examples and multiple formats. B. One format fits all. C. Complex language for all diagrams. D. Randomized grading. 29. Which evaluation type best suits mentoring outcomes for MoCA skill building? A. Ungraded participation logs. B. Performance-based skill demonstrations. C. Standardized written exams only. D. Attendance sheets. 30. How can instructors support struggling learners with visuospatial deficits? A. Provide direct modeling and immediate correction. B. Avoid giving feedback. C. Eliminate complex visuals. D. Let learners work alone. 31. What is a common error in MoCA executive function interpretation? A. Overemphasizing drawing neatness over planning. B. Using structured scoring rubrics. C. Analyzing error types. D. Recording visual accuracy. 32. What instructional method supports metacognitive awareness in visuospatial skills training? A. Instructor-led critiques of learner performance. B. Unstructured group feedback. C. Limited learner reflection. D. Automatic feedback tools only. 33. Which mentoring tool increases skill transfer when teaching MoCA? A. Random task assignments. B. Performance rubrics and scenario-based coaching. C. Standard lecture notes. D. Self-review quizzes. 34. How should adult learners be evaluated for visuospatial improvement? A. Through peer rankings. B. Through structured task performance over time. C. Based solely on self-report. D. Using unrelated aptitude tests. 35. What does the MoCA cube drawing task evaluate? A. Depth perception. B. Planning, visual construction, and coordination. C. Color sensitivity. D. Vocabulary. 36. Which regulatory principle applies when recording MoCA test results? A. Record only exceptional scores. B. Maintain complete and confidential documentation. C. Publish scores to motivate staff. D. Edit poor results for morale. 37. How does curriculum alignment improve MoCA test instruction? A. Streamlines staff responsibilities. B. Ensures learning objectives match MoCA tasks. C. Focuses solely on executive coaching. D. Emphasizes legal risk avoidance. 38. What should mentors focus on during feedback for visuospatial task performance? A. Final score only. B. Learner's problem-solving strategy and visual approach. C. Personality traits. D. Drawing style preference. 39. What is a key feature of visuospatial curriculum design for adults? A. Lecture-dominant delivery. B. Contextual and experiential learning modules. C. Eliminating challenge. D. Following a child-based template. 40. In what way does reflective journaling support MoCA-related executive training? A. Hinders cognitive engagement. B. Encourages personal awareness of problem-solving methods. C. Distracts from skill application. D. Replaces formal instruction. 41. What aids in differentiating visuospatial instruction for diverse adult learners? A. Uniform instruction for all. B. Use of multiple representations and real-life analogies. C. Avoiding hands-on activities. D. Eliminating feedback. 42. How can adult learners with visual motor impairments be supported during MoCA training? A. Skip visual tasks. B. Provide tactile visual simulations. C. Rely only on verbal instructions. D. Allow substitution with essays. 43. What aspect of mentoring ensures ethical test administration? A. Skipping low-performing learners. B. Modeling best practices and confidentiality. C. Guessing scoring outcomes. D. Encouraging competition. MoCA Executive Function and Visuospatial Skills Test. The MoCA Executive Function and Visuospatial Skills Test is a specialized subcomponent of the Montreal Cognitive Assessment MoCA. Designed to evaluate higher-level cognitive abilities such as planning, organization, abstract reasoning, and visual motor integration. This portion of the MoCA includes tasks like clock drawing, cube copying, and trail making, which require individuals to process and manipulate visual and spatial information while engaging executive control. It plays a crucial role in identifying early signs of cognitive impairment, particularly in conditions such as dementia, stroke, and traumatic brain injury. The test is widely used in clinical, educational, and rehabilitative settings to support diagnosis, track progress, and guide intervention strategies. Here are the top 5 beneficial uses of the sample exam. 1. Early detection of cognitive decline. The MoCA Executive Function and Visuospatial Skills Test is vital in identifying early deficits in planning, sequencing, and spatial awareness, which are often the first signs of cognitive conditions like Alzheimer's disease. 2. Clinical decision-making. It provides objective data that assists healthcare providers in making accurate diagnoses, planning treatment, and developing cognitive rehabilitation strategies tailored to the individual's needs. 3. Monitoring disease progression. Regular administration allows for tracking changes in executive and visuospatial performance over time, helping clinicians assess disease trajectory and treatment efficacy. 4. Support for educational and occupational planning. Test results can guide recommendations for job accommodations or learning strategies in individuals with cognitive impairments. 5. Enhancing caregiver communication. Results offer concrete language to explain impairments to caregivers, improving understanding and collaboration in care planning.